So thank you, Ellen. That's really very, very useful work. I think we have several questions and comments in the Q&A that I'm going to be addressing to either Louise or to Ellen. And there's a couple I'm going to answer myself. But I think an important thing to point out, which I didn't in the introduction, is that Louise's work was first done in 2013 and Ellen's is hot off the press. So literally we dragged her in, and I'm not even quite sure that the guide was physically available when we got you to commit to doing this. So there's a level of publication detail that is perhaps more advanced in the case of Louise's work than in the case of mine. So we have a first question that I'm going to start off with because I think I have some of the answers, and it's not specifically to a speaker. It's a question from Paul Taylor, who says, my question revolves around research of the financial costs of a failed return to work program. One major issue with return to work is the lack of accountability within the law, with employers, workers, compensation boards, and doctors. Is there any research focused on the financial costs of the lack of this accountability? Most importantly, the costs when workers are forced back to work when they are unable to. For example, in Ontario, it is estimated that on average each month there are more than 4,444 injured workers on Ontario's taxpayer-funded social assistance programs. This is an estimated cost of $30 million a year. I'm going to ask Ellen and Louise just in case they know something further, but what I would first respond is, in terms of our team itself, we do not have an economist on our team and we're not doing economic analyses. In Quebec, the IRSST has an excellent research product that looks at the real cost of work injuries. I'm not sure whether it's available in English, but certainly the abstract and a detailed abstract would be available in English. So if the economic consequences of work injury are of interest to you, be they for mental health problems or physical health problems, I would recommend you look at their site. For specifically mental health problems, I know that Carolyn Diwa has done a great deal of work on evaluating the economic consequences of mental health problems related to work. And I would strongly recommend that you Google Carolyn Diwa. D-E-W-A is her last name, and she's a prolific writer in English. Ellen or Louise, do you have anything to add to that question?
Yeah, I think it's a great question. And I mean, the challenge is that the costs are always segregated, right? And so it may be when a worker, for instance, when the return to work isn't succeeding and a worker just quits and decides, I just can't take this anymore, it's actually cheaper for the employer because they're relieved of that claim, especially if it's workers' compensation claim. And so we need to look at the societal cost and the cost to whom and much more broadly. And so we need to think about the cost, and at present, it's the employers don't see the full cost, nor does the workers' compensation system.
And I don't see Louise waving her hand. So, do you want to speak? You have to unmute your microphone.
Yes, okay. Do you hear me?
Yes.
We need also, this is indeed a lack of, on this subject. In addition, we need to push the costing concept future to integrate the broader vision that takes to account the issues of sustainability at work. We must think not only in terms of return to work, but also in terms to measure a job retention and also the effect of poor integration into the workplace. But many studies just focus on the return to work. They measure only return to work problem.
Okay, I'll go to the next question, and there's sort of several questions asking us to put up hyperlinks on the chat. So we had a question previously from Margaret Oldfield asking for the link to our site. And now Christine Gaptil, she's been asking for references to Ellen's work. And more specifically, she said it would be great if she could have the hyperlink to Ellen's slide presentation. I think with Monique, we've been trying to figure out how to do this in the chat. What I would suggest, if we haven't resolved that, because we've been copying it into the chat, but I don't quite know how you can copy it out. Just Google my name, Katherine Lippel, you get to our chair. And once you get to our chair, there's a link specifically to this project. Look under projects. Our website is both in English and in French. And under projects, you will find the link to the website for our project that we're discussing today. And of course, Monique has optimistically said everything's going to be online in 24 hours. I would say be patient just in case life is not as perfect as we hope, but it should be up within the next week or so. And send me an email personally if you have difficulty finding it. If I can, I'll try and get my screen up again with the link, but it's hard for me to both manage the Q&A. Okay, and at the same time try and put myself into slide view. So Paul, by the way, has said thank you, and it'd be great if you could do a show notes afterwards. That would be great. Again, amazing presentations, and thank you for the answers. So thank you to both Louise and Ellen from Paul, and from Anudon, who has expressed great interest, and Christine, of course, was pleased as well. Now, we have a question which I think is important for everybody from Marie Carpentier, who is from the Human Rights Commission of Quebec. And she asks, she says, thank you very much for your presentations, and they're very interesting. I was wondering if substance addiction problems without other health problems identified were included in your respective researches, and if that is the case, does it present specific challenges? So I don't know if Ellen or Louise wants to talk about les dépendances or substance addictions in relation to the work you've been doing. And if so, I see Ellen's ready. So go ahead, Ellen.
Well, I can't provide an answer. I can just sort of reinforce that we also conducted a scoping review of return to work coordination in relation to mental health. And that was one of our critiques of the literature, is that we're lumping all of these different conditions together. We have common mental health and severe, two categories, but even within common mental health, depression will be quite different from anxiety, which would again be quite different from substance abuse. And there isn't very much out there that's specific to those conditions. And that's something that we need as next step. Maybe Louise knows more about this than I do. I bet she would.
Yes, one must also intervene by reviewing the dimension related to the work. This is a major point to support and also to regaining control of one's work and reducing anxiety about returning to work. This is, you need to focus on the work and what is the new condition, what you need to analyze and evaluate the work. I think the work is my focus.
And if I can add to what Louise has just said, and linking with Marie Carpentier's question, what we see with workers who have physical problems that are caused by work injury, they develop problems of substance abuse because they're forced to go back to work too early. And then the substance abuse problem overrides sometimes the consequences of the physical injury. And it may or may not be compensable depending on which jurisdiction you're in, but it creates new health problems that in itself need to be accommodated and need to be addressed both by the compensation boards when it's a case that goes through compensation, or by the insurers. So it's all, I agree with Louise that the work is really key, because if sometimes the substance abuse problem is created by the return to work process. Not always, of course, but sometimes it is. I'm going to keep going because we've got quite a few questions here. So I've got a comment from Margaret Oldfield. Thanks, Ellen, for your humane view of workers with mental health conditions. I noted some similarities, particularly workplace relationships, with research I've been involved in on cancer and mental health conditions. So your findings may be transferable to the situations of workers with other invisible and or stigmatized health conditions. What do you think? And this is a question for Ellen.
Yes, I mean, as I said in the introduction to my presentation, really it boils down to communication, right? And talking and listening to the worker and trying to understand their situation. And that is a strategy that could be effective for any health condition. Yeah, just very respectful and careful understanding of the situation is a generic approach that can be very effective.
Okay. All right. Now, Louise, tu veux commenter là-dessus ou ça va? Okay. Okay, the next question, and this is a recurring question, and just a heads up to my technicians, when I finish managing the chat or the Q&R, I am going to put up my desktop again, because on my desktop there's the slide with the links. So I'm going to try that. But if not, Google is the answer to your question, because getting the links up while we're very, there's a source of stress involved, if I can say, managing webinars by people of my age group. I'll just leave it at that. But we'll get to that. We'll try and get that up. We have a nice comment from Dharmesh Lal, who is in India. And this is to both Louise and Ellen, a nice and comprehensive question. Can I get hard copies as I am from India? So I don't know how to answer that. I don't know if, of course, the obvious answer is that they can be downloaded and printed. But Louise and Ellen, are there ways in which somebody can order a hard copy of your guide?
Yeah, I have hard copies. Like here's one right here. So just email me. I have my email at the end of the slides.
Okay.
I have also one.
Okay, so the process is when you get access to my website, you download the slides. On the slides, you have the emails, and you write to respectively Louise and Ellen, and they will send you on the guide on paper. And thank you for your question. Oui?
Katherine, I've just emailed everyone the evaluation of the webinar, and in that email, I have included the link to our website. And from the website, I will be putting both Louise and Ellen's presentations. And on our website, when you look at the section of team members, you'll be able to find Louise and Ellen's email addresses if you would like to keep the conversation going. So just wanted to mention that.
Thank you so much, Monique. That makes things a lot easier. Good. Okay, so the next is a comment from Anudon, who is a rehabilitation professor, physiotherapist, and she agrees with Margaret Oldfield here. And I also think that the guiding principles of this guide would apply to all conditions, mental and physical. So I take that as a comment. I don't know if Anne and Ellen and Louise, you want to say anything about that?
I think maybe what Anne is saying, that even with physical conditions, you know, an X-ray or an MRI isn't going to be the be-all and end-all either. So Anne would be able to, you know, she knows about the subtlety and the challenge of health conditions. Yeah.
Good. We have another question, and this is from J. Irvin 3, who I'm not quite sure where you are. The question is, will CEU certificates be provided? What I suspect that this is continuing professional education in a jurisdiction. I'm not sure which jurisdiction you're in. If you were in Quebec, you don't need certificates anymore if you're a member of the bar. If you're a member of the medical profession, I don't really know. What I would suggest you do is that you write an email in response to what Monique has just sent out, asking us if we can provide a certificate. And because we have people, I think, from 50 different jurisdictions on the call. So I can't really answer the question, but we would, get in contact with us personally, and we'll see if we can accommodate you on that. Certainly, if you were if you were a member of the bar in Quebec, I would see this as something that you could apply for accreditation yourself. In that process, all you have to do is provide the description of the program as such. And if you need documents from us confirming your attendance, we will provide it. But for the other jurisdictions, I don't want to adventure too much detail. And certainly outside of Quebec and Ontario, I'm not sure that we have much to be able that we can do, but worth trying. Okay, here's a good question, probably for both of you, from Dharmesh Lal again in India. Can there be any screening tool as part of preventive mental health program? And Louise, should I translate this question? Because it's probably a question.
No, it's okay. I think the idea will be more to have a screening tool for work-related problems than the mental health problems. If you have a tool to evaluate the work-related program, I think it's your best focus.
Do you know if such a tool exists?
But this is why I propose this kind of evaluated return problem. It is the occupational health approach. You need to evaluate what is the problem on the work, and you need to focus on the work. Then focus on the mental health individual problems.
So what I would add, because it's very clear, is that you made the point in your presentation that some of the issues of the individual worker might be issues shared by other workers. And so you can use your guide to do prevention, primary prevention for all the workers in the workplace.
This is exactly. Thank you, Katherine.
Thank you. That was good. Ellen, do you want to add something?
Yeah, I just wanted to throw in that there is the Canadian standard on psychologically healthy workplaces as well. That is kind of in line with what Louise is saying, in that there is I don't know if that's the exact title of it, but there is a strong focus on what could workplaces do to be psychologically healthy. Yeah, and that's a screening for the workplace, effectively.
Yeah, so that's a good point as well. The Mental Health Commission has a copy of that standard. It's free online. I'm not sure if it's free. It used to be free, and it can certainly be downloaded. So we have a comment from Steve Mantis. Thanks so much, Ellen. Did the project uncover issues related to contradictory practices as mentioned in Louise's, okay, hold on just a second. My question just left. I was going to say, Louise's presentation. If so, how did the return to work coordinators deal with it?
Steve knows how to ask a loaded question because he was on that study, so he knows. And I was telling Katherine before this talk begins that I have other presentations that I have prepared and I've given on these contradictory situations. But I'm happy to address it briefly here. And that's that our study involved interviews with return to work coordinators, and the coordinators themselves are workers. They have their own performance standards, they have their own budgetary guidelines, they have their own caseloads. And so when we looked at how they managed return to work in the context of them being workers too, we saw that the ideal of best practice wasn't always being followed because of time constraints, caseload issues, and these sorts of things. And so we definitely uncovered these contradictory challenges. Also, you know, who employs the return to work coordinator can have an effect on how they see things too. So although we depict them at the center in the front line, they have their own positionality as well within this whole thing. So it was much more complicated. It was a complicated situation. And in the guide, what we present are the roadblocks and the alternate routes. But there's a lot more to the situation that we hope to share in other ways as well.
Okay. The next is a comment from Dharmesh Lal, who is interested in collaborating with our program. He's from India. And I would just suggest that you write us an email, and I, as team leader, will get in touch with you directly, and we can discuss how we can move forward on this. And we're thrilled to see that this is relevant for you. The next question is Adam Siegler. And he says, I have a question regarding the idea of contradictory practices in the workplace. I'm a union representative in a large correctional jurisdiction in Canada. One of our challenges has been addressing the psychosocial stressors in the workplace, moving to a preventative model from the current reactive one. This is tied into the challenging return to work process. Hold on just a second, because my question just left. Particularly for mental health injuries that occurred in the workplace, battling the stigma of you signed up for this job. The concept of contradictory practices provides a name and framework of what we have been trying to articulate. Do you have any specific strategies on how to address these contradictions in the workplace, both at the individual level and at the organizational level? And I think that's for Louise. So you want to go ahead, Louise?
I think it is the same also question to Michael Swinburne, the next question. I can say one of the contradictory practices is taking the time to review all the practice and the responsibility of each of the stakeholders and ensure that they were consistent with each other and in line with the vision of support that we want to promote. This is why you can see on the guide, we take a time to describe all of the practices and the responsibilities of each stakeholders. It is really important to take this time, and this is the first step before engaging this kind of program. This is one of the most important also. I'm not sure I'm clear. Katherine?
Yeah, I find it clear. I don't know if Ellen wants to add something. And of course,
I think I would only be repeating what Louise said. Yeah, nothing to add.
Of course, I mean, having the senior managers buying in to the process is absolutely key if you don't want to have the supervisors being in a contradictory position. And I think that is really key. But I think that's been said by both speakers very clearly. Michael Swinburne, Louise answered partially his question, but I'm just going to repeat it to see if Ellen wants to add anything, because it's specific to COVID. Given the current context, including the very real risk of infection and the fear that accompanies this risk, what are some of the most important preventive measures an employer can take to mitigate the potential mental health challenges re-entering a risky workplace? Many employees who have not previously experienced mental health conditions such as anxiety may be returning to work under very abnormal and discombobulating circumstances. Does anybody want to add anything to that?
I would just add that, you know, having very clear communication is so important, and understanding the source of how decisions are being made is very important. And so it might be important for a workplace to have representation on some sort of decision-making committee from workers, from supervisors, from people in different places, and who create really who develop a real understanding of what the concerns are and how to communicate clearly the solutions, and also the what ifs, like what will we do if we have cases that come into the workplace and we're infected, what's next, right? So there's the if-then strategies. It's difficult for employers now because a lot of them aren't used to having to think in this way, and it's a new way of thinking, and there's a lot of uncertainty even today about the mode of contagion of this condition. But the best thing that employers can do under conditions of uncertainty is to be really, really clear about what decisions are and how they're being made.
Louise, would you like to add something? you're muted if you
No,
want to.
it's okay. I'm agree with this answer.
Okay. I think the only thing I would add, because I've been doing quite a bit on COVID and health and safety, is that it's important to understand the sources of the concerns of the workers and to have a policy in place for workers who, because of the individual circumstances, including if they have children who are immune suppressed, for instance, that there is wiggle room in the policy. So it's not just, it's important to have the policy understood, but it's important to have a policy that is not going to terrify the workers because they're being put in a situation where they have to choose between the health of their family or their job. And that's what we've been saying over and over again. All our laws in Canada are not necessarily very good for the accommodation of issues related to vulnerable family members, because if the worker is vulnerable, there's a lot of good policy coming out. But workers don't want to lose their jobs because they're trying to protect their kids who are in treatment for cancer, for instance. So that is something that has to be watched by all policymakers and by employers as well. Okay. Now, my next question is from Alex Medley, and it's to Ellen. He has a two-part question. I'm wondering if you can touch on the WSIB's Better at Work approach, its guiding principle for return to work. How does this approach interact with workers' mental health, and has the board signaled that it is altering its approach, especially in light of recent research on return to work and mental health, some of which reveals that even the process of workers' comp can lead to mental health issues for injured workers? So that's for Ellen. I'm going to let you go ahead on that.
Thank you. It's not always better at work. That's my one-liner. It really depends on the quality of the work, the quality of the accommodation. A lot of return to work policy seems to be based on this rosy notion that there's this great workplace and everyone's great friends and they do wonderful work and everyone looks out for each other, but not every workplace is like that. There can be toxic situations in workplaces. There can be very difficult work situations. And so returning someone to a very bad and unhealthy environment is not always the best option either. And so my stance on Better at Work is to look at the work. What can we do to make this work healthier for you to go back to? And so that if we want to go along with this idea that return to work is rehabilitative and all of that, then rehabilitative within a context where the workplace is supportive, is healthy, doesn't include hazards. Yeah.
And I would add that Ellen has written many things, but particularly the toxic dose of system problems, which provides more information as to how she's been addressing the issues that Alex is raising. It's a really important article. Okay, I think I just, so Paul Taylor has asked again, how common is addiction found to be, he says a question for Ellen, but maybe Louise has knowledge on this as well. How common is addiction found to be caused from the treatment of work injury treatment, opioids? I know there's publications on this that have just come out. I don't know if Ellen
Well, it's one of my great regrets that it's something I've presented on but haven't published on. It was a key finding out of I had a lot of findings coming out of a study I ran a number of years ago about complex claims, but they were kind of looking at workers kind of being pushed into taking drugs because they were afraid to lose their jobs if they couldn't manage the accommodation and back to work, but they couldn't actually manage the accommodation without taking really heavy drugs sometimes. And so you ended up having workers who, because of the return to work situations, ended up becoming addicted. And it was interesting because there was a reporter out of BC and she was writing about it, I think it was in the Globe and Mail within the last few months. And when I saw that article come out, I called her up and I said, that's so funny because it's exactly what my research was. And we had a good chat about it. And what is the role of people involved with return to work in terms of their involvement in addictions, right? Like, can they say that they're innocent of involvement in addictions as well? And I think we need to think a little bit more about how accommodated return to work looks and what roles drugs play in the role in that as well.
Okay. So I think the next question is from Jean-Paul, perhaps Jean-Paul Dautel, who says, thank you, Louise and Ellen, for your extremely interesting presentation. So my question would be on how to communicate about mental health problems with coworkers. Do you encourage this kind of communication? Who does it? What kind of information is shared? Under what form? And are there any limits to doing this? And I guess we can start with Ellen and go to Louise.
We'll start with Louise and go to Ellen, if that's okay.
Louise, veux-tu répondre en premier? I think there's a linguistic issue.
Oh, okay. Then I'm happy to go forward then. I just felt that Louise is the psychologist, and so she's good with this stuff. But how to communicate about mental health with coworkers. I mean, the issue that came up in that respect in my study was about privacy as well, right? So it's possible to do workplace education to say, you know, this person's coming back and they've been through these situations and this is how you can support them, but then that would be not respecting their privacy either. And so in our study, the coordinators talked about the need for general workplace mental health literacy. And so it wouldn't need to be tagged specifically onto a specific injured worker returning, but it would be something more routine that's embedded in workplaces procedures.
Thank you. Which, Louise?
Yes, but obviously it is really necessary to take the time to prepare the return to work, the return to colleagues. But one of the points is to remember it's also important to see how the worker returning to work wants this to be discussed. This is the key point. Talk to the worker before and after. You can know different view, but you need to prepare, with the worker who had been absent from mental health. It's clear? Jean-Paul, est-ce que c'est clair, Jean-Paul?
Il n'y a pas le droit de parler, Jean-Paul. I think it was very clear. In other words, the place to start is ask the worker what the worker would like.
Yes, because you need also to put the workers in the center of the plan of the return to work. This is the place. It is really important to confidence, but also to diminish the anxiety. It is really the key. Talk to the worker. The space to talk to the worker, to prepare with the worker.
Thank you. The next is a comment, and it's a useful comment if people are following in the question and answer. Margaret Oldfield has pointed out that the Mental Health Commission of Canada also has the Mental Health First Aid Program, and there's a link, and training for organizations to improve psychological safety in their workplace. So people can certainly copy down that link. That would no doubt be useful. Victoria Shore asks a very important question to both. Are there gender differences that are observable? Is the data parsed in such a way? And I don't know if either of you, if either Louise or Ellen wants to talk about la différence entre les hommes et les femmes par rapport à l'outil.
Yes.
Yes, what? Okay, go ahead. Je t'entends pas, ton micro est fermé.
This is a really interesting question. I think we have a difference, and a part of this difference, it is inside the invisibilities of a part of the work. The difference with a part of the work between men and women, and this part is on the conciliation between work and family. we need to have a better reference framework to understand what is the specific work for the woman. And you need to understand, this is, we work about this specific view with my next guide. We think about, and it's really important to think the different kind of support you need to have. Also, you need to take account about the conciliation work and family balance for the woman. And this is a big part of the return to work.
I'll just add to that. In our study, we weren't able to, we didn't get a gender difference in terms of the people who were returning with mental health. We did see a gender difference in terms of our return to work coordinators and their approaches to return to work and mental health. It was interesting because among return to work coordinators, we realized it was a profession with a very, very high turnover rate. People don't last too long in that position. The men tended to, in our sample, tended to have been there for longer, a bit more rule oriented. Women, a little bit different situation. But one thing that did come out was in talking about their clients, so to speak, was age. We saw different people talked about differently in terms of their age, and a little bit less effort being put in for some of the older workers. And so we have an analysis specifically emerging about the age dimension.
Thank you. As a complement to that previous question, Michael Swinburne, who I believe is from the Canadian Human Rights Commission, from what he says, thanks for your responses on the issue of family or caregiving responsibilities and conflict with work responsibilities. The Canadian Human Rights Commission has a useful guide for balancing this tension. This is a guide I didn't know about, and certainly I will be downloading this. And I'm hoping, Monique, that everybody will be able to have a copy of these questions that have some links in them. And we can try and figure that out once this webinar is over. But the link is up there to the Canadian Human Rights Commission for that guide, and I think that's precious information. The next comment is from Cindy Drake, and she says, the employer that I am currently working with is a community mental health organization. We struggle with agreement on return to work plans as recovery timelines and essential accommodations are frequently dismissed as unnecessary. Any suggestions on how to effectively address this issue? I don't know who wants to go first on that.
This is why we work with Katherine to develop a different kind of guide to support unions to work with the kind of organization they didn't want to organize or to intervene with the real organizational problem.
Ellen, do you want to say anything about that question?
Yeah, just to support that, in our guide, we reinforce over and over again that the importance of working with representatives, if they're available, to help with problem solving around these situations. Yeah.
Okay. I see I skipped over a question. I'm going to go to Bonnie Giffen's question first because this is her first question, and I will get back to Paul Taylor's. We have about 12 minutes left. I think we have enough questions unless there's a burning question that somebody wants to add. But Bonnie says, as a union steward, I have members who complain about managers not knowing how to handle interpersonal conflicts in the workplace, which cause anxiety, fear, and depression. Can you recommend an institution where management can get educated in helping and accommodating employees with mental health diagnoses? Who wants to get that one first?
That's a really good question, and I don't know the answer to that. I don't know if Louise has any knowledge of resources. There's just the Canadian Mental Health Association, possibly. Yeah.
Yes, we have a difference between a private sector and public sector because we have different kind of support, different kind of support, but I don't have a specific result to publish about this question.
Well, the question is which institutions can provide training to managers? And of course, I suspect that you would know the institutions in Quebec. But what I would think is that the IRSST, which has dozens and dozens of publications, might have lots of tools to train managers. What I would say personally about this question is that you can say where the tools exist, but you can't get the managers to want to read the tools. So that it's a separate problem. There might be lots of services, and I agree with Ellen, the Mental Health Commission probably has lots of interesting webinars available. But as to how you can get institutions to want to buy in enough to liberate their managers to follow these training courses, that's a separate question. But I don't, unless somebody on the panel wants to add something, I would say in French, go to IRSST, in English, Mental Health Commission, human rights as well. The Canadian human rights agencies might have publications in relation to this. If anybody is on the webinar who has better ideas than what we've said so far, that would be helpful. And I see that Christine has come up with the Pacific Coast University for Workplace Health Sciences, which I'm not sure, Ellen knows more about that than I, but in any case, there's a link there.
Okay.
But I want to get back. Did you want to say something, Ellen, on that? No. That's NIDMAR, I think, but I don't want to say anything about that right now. Paul Taylor, in return to work programs and measuring success, were there any findings about the type of work or level of education, pay rate of workers compared to less educated, less paid workers? Example, factory workers compared to office workers and or unionized workers compared to non-unionized workers and temporary workers. And I don't know who that question is directed to.
Well, I could just say that in our study, the questions weren't designed to get at those sorts of issues. So I wouldn't be able to say anything about those issues. I do have a study that's currently funded, two studies actually, looking at the situation of workers' exposure to COVID and their ability to stay safe in the pandemic, focusing on workers with low wage or workers who are doing gig work. And certainly the structure of your work, if you're low wage, if you're doing gig work, if you don't have paid holidays, all of those things will have, quite an impact on your health at work. So that's just sort of the generic answer to your question that is what I can provide now.
And unless Louise wants to add something, what I would add is the chapter, Ellen in her presentation mentioned the book that she edited. And my chapter in that book compares the workers' compensation in Quebec and Ontario, the systems, and how the systems design the level of investment of the systems in the rehabilitation programs, which vary significantly depending on whether you're looking at a low-wage worker or a high-wage worker. So that's not data, but that's research on systems, if that's of interest to you. And I think we have one final question, and maybe it's a comment. Adam Siegler. This resource is not specific to accommodations, but geared for improving managers' understanding of mental health issues in the workplace. It's exactly on point. It's a workplace mental health leadership certificate through Queen's University. Here's a link for a starting point. So thank you very much for that last comment. I believe we've managed to address everybody's questions. If you have questions that I somehow missed, please don't hesitate to write to us and we will forward those questions to the speakers or try to answer them ourselves. I want to take the remaining time My machine's talking to me, it's confusing. Okay, I want to take the remaining time to, first of all, thank both of our speakers for doing this first public webinar for our team. We've had several webinars privately, but it's a big team. We've got about 40 or 50 people on our webinars, but having an international multidisciplinary webinar on these two new tools, or these two tools, one that's very new and one is not quite so new, but perhaps less well known in the English community, I think is a great contribution to the conversation. And I'm thrilled that so many people participated, first of all, registered and continued, stayed online, asked questions, asked great questions. And I'm hoping that we'll find a way of sharing the feed that is on the Q&R with everybody. Monique and I will no doubt find a way of putting this on our website. We've got lots of people writing in now saying thank you very much. And so I'm thanking all of you, and please, particularly if you want to know more about our team, but also if you just want to get in touch with us and be informed about our next webinars, or if you have ideas for the next webinar that you would like to see, we would be really happy to hear from you. So I don't know if Louise and Ellen want to say a last word.
I just want to say thank you very much for this opportunity, and to those of you who I know who are asking questions, it's really nice to hear from you, albeit through this dimension. And yeah, it was really nice to have this opportunity to share our research. Thank you.
I just say also thank you very much for your attention, and to give us a pleasure to share this kind of work. Thank you very much, everybody. Thank you for your question also.
So thanks very much. And that's the end of the webinar, and stay tuned for the next one. Thank you.